Hi everybody, this is Dr. Stanton. I wanted to make a video for you guys to kind of explain and emphasize the importance of investing in your health. And one of the most cost-effective and important and valuable ways you can do that is through being on an ID nutrition regimen of supplements and vitamins and minerals. So this is a highly customized program that you can be on. If you want to take a free health assessment, it's private, it's HIPAA compliant. You can go to my website, which is www.drdr, that's dr Stanton, Stanton, so drstanton.idlife.com. If someone else is sharing this video with you, and ask them what their website is, and you can take it on their website. I recently had a patient come in who was complaining of back pain, migraine headaches, insomnia, fatigue, constipation, and some hormonal complaints, which I won't get into, but just some general hormonal complaints. I evaluated their history and their symptoms and did an examination. And at the end of the visit, we had them take a ID nutrition health assessment. So after they were done, the health assessment came back, the software, this is science-based software backed by over 8,000 different third-party clinical studies that study nutrition, interaction of nutrients, and how they help with different types of conditions and symptoms, and also how they interact with medications. But basically, it designed a regimen for this individual of 10 different supplements, some which were designed to take in the morning with breakfast, and some that are designed and efficient to take in the evening with dinner. So 10 different supplements at a cost of about $80 per month. This is very cost effective, and I'll get into that part later. But we also ordered some lab work. When we got the lab work back, it indicated that this person had a vitamin D deficiency and a bacterial infection, more than likely a chronic low-grade infection, and they couldn't believe it because they didn't feel sick. Well, other than the fact they had the symptoms that I just mentioned, which if you do have a chronic low-grade infection, it could be anywhere in the body, and it could just be creating some fatigue that you normally wouldn't have. Another reason that they couldn't believe it is because not only didn't they feel sick, but this person eats very, very clean, and according to what they told me, and they exercise and they're very fit. And so I commended them for that, for their efforts, and I also had to, remind them that, look, what you're doing is good, and if you weren't doing what you were doing, you'd be in a deeper hole than you are. But this is all the more reason why you're doing your macronutrients with your clean diet, but you need to supplement your diet with the micronutrients, with the vitamins and minerals, and a customized, personally customized regimen that's science-based is the best way to go. And here's why: because it's cost effective. They said, well, can't you just recommend a multivitamin, a vitamin D, and a fish oil for me? And I said, well, I could do that. So I said, I'll do that for you, and I'll get back to you and let you know what the cost would be. So basically, to make a long story short, the cost of those three things that I normally would recommend, and I used to use some companies that I looked up. I still use a few things for acute injury, pain, inflammation, and infection. But for foundational health, I use the ID Nutrition on everyone. But for those three things, the cost was over $100. It was like $101. That's retail price. So that was $20 more than her whole regimen that the ID Nutrition was recommending. But what I did is also did a price comparison to what they would need as far as the 10 supplements and how they would compare in price. So just to kind of give you an idea, the multivitamin was $32, the D3 was $22, the 5-methylfolate was $27 and change, the vitamin C was $22 and change, the omega-3 fish oil blend was $49 and change, the calcium lactate was $16 and change, magnesium supplements $22 and change, the hormone balance supplement was $33 and change, CoQ10 supplement was $42 for a 60 count bottle and change, and the evening primrose oil was $43 for a 60 count bottle. If you add all that up, it comes out to over $310. That would be the initial cost to get on the regimen, and it's not even going to it's not even comparison, because now you have all these bottles you have to contend with, and whereas in the ID Nutrition it all comes out in packs, so it's all divvied out for you already. Your PM packs together, your AM packs together, and it all ships to your house, and it all runs out at the same time. Whereas all these others, they're different bottle counts, and so some of them run out different times of the month, and it's just gets really confusing, and it's not convenient. And so my whole point of making this video was, you have to invest in your health. I know cost is all relative to the individual. For somebody like this person who doesn't, who's not used to spending any money on supplements, $80 is kind of a stretch. But for my patients who, before 2.5 years ago, before I started using ID Nutrition, they were spending $300 a month. Now they might spend $150 or $200 a month in their ID Nutrition. Sometimes it's even less than that. Like for example, hers was only $80. So for somebody that's used to spending $250 to $450 a month on good quality supplements, and getting a result, $80 to $100 is a drop in the bucket to them. And as far as, they don't have to mess with bottles, the convenience of it is amazing. So basically, invest in your health is important. You have a choice. You can either do it or not do it. If you don't do it and you ignore your health, guess what? It's going to go away. That's all I have for you. Hope you enjoyed this, and I'll have some more videos coming out soon.